Welcome to Effing Details Podcast.
Vancouver's kick-ass business stories unleashed. Hey, welcome to another edition of the Effing Details Podcast. I am Mark Simmons.
I'm Jill Simmons.
And I always say you are in all the other ones, and then you say Jill Simmons, but not today. That's how much more professional we are.
Excellent.
We're on the ball. We're excited to have you back, and thank you for tuning in to another edition. So before we dive into today's podcast episode and our guests, we have what's that knock on the door? Housekeeping. Okay. So housekeeping. I'm a dad, so that's what I do, and I don't apologize, although sorry. Okay, that's the Canadian in us. All right, so here's the thing. Number one, please. No, it's a word bag. Please subscribe to our YouTube channel. We would love for you to subscribe to our YouTube channel. You can follow our podcast on Spotify, on Apple Podcasts, on iHeartRadio, on Amazon Podcasts, lots of places. Or check out our website at
effingdetails.com,
where we have all the links, all our videos, all the podcasts, easy to get to. And the last piece of housekeeping is please either read the disclaimer at the end of the video or read the disclaimer in the descriptions of the podcast or YouTube. Awesome. Here we go.
Perfect.
So we are Effing Details Podcast, and our theme, as always, is Vancouver's kick-ass business stories unleashed. And we're ready to unleash another kick-ass business story today with our guests today. And what we look for, people that everyone has a journey, has a story. And Jill and I do a lot of network. We meet a lot of amazing people, and our guest today is included in that. So it's our pleasure to welcome to the show,
Dr.
Garrett Bramall.
Hey, thanks for having me on, you guys.
Welcome. There's going to be a lot of people watching here. They're going to go, oh, I know him. I know him. And funny thing is, the last person we interviewed also had a lot of height. Nice. You have a lot of height, so maybe that's our thing. We're interviewing tall people.
Going taller and taller.
Just
by
tall
next
people.
week, you'll have Shaquille O'Neal on here, and you'll have to extend the
That's
set.
right. Yeah, we're going to need a bigger boat, a bigger set. So we're happy to have you on the podcast today.
Thanks for having you guys.
Yeah. So today we're looking forward to learning more about you and your journey and what got you to where you are, which you are a what for profession?
Naturopathic physician. So in BC, licensed as naturopathic doctor, naturopathic physician, kind of the main two qualifications to doing what I do.
Excellent. So first question, how do you become a naturopathic doctor?
So to become a licensed naturopathic doctor in BC, because there are people who get a 30-second weekend course and claim to be naturopaths, don't really provide medicine. Different, but to do what I do is you go through your undergraduate degree, typically in science or biochemistry or kinesiology in my case, and then you do another 4 years of naturopathic medical school, plus or minus your residency, or what allows you to then go in and focus on something ultra specific.
So lots and lots of training.
Yeah, solid at least 8 years, if not a couple more years to get good at what you do, because as with any profession, you go through school, and that just gets you through the basics to the baseline. From there, you have to go get good so that people can come to you with confidence that you know what you're doing.
And to get into naturopathic school, do they interview you? Is it very selective? Is it tough to get into?
Yeah, you certainly go through your regular interview process. You have to have an appropriate GPA, and typically the life experience helps with that, because medicine as a whole has kind of evolved over time, where they at first thought, hey, we need people who've got 99% across the board, and kind of disregarded the idea of personality and ability to be empathic and relate to people. And they had a lot of really awesome physicians out there. And then when patients asked questions, they didn't have answers for them because they only knew the textbook.
Absolutely.
And they've since evolved that back to this understanding of life and people matter, because you're treating people, not algorithms. And it's all part of the process.
And that's actually in traditional medicine as well. They've
100%.
They've changed it so that when they're looking at becoming a resident and picking, they're looking at not just, it used to be grades, and it used to be the top, the best of the best, but then personality came in, and are you a team player, and how do you communicate, and yeah,
because you can be awesome, you got to be awesome, but you also have to be able to relate to people.
Absolutely. Yeah.
100%. So you jump through those hoops, then you go through 2 different licensing exams, your board exams, and then once you're done all of that, pay all your fees, get your insurance, and off into the world you go. And at that point, every year is just about upping your education and improving the skills and deliverables that you have for your patients, so that you're not just staying at that baseline where you graduate, you're leveling up as you go.
Wow.
And what was, so what was pre-doctor? What was young Garrett like?
Young Garrett was just the athlete who liked to run around and have fun. Mm-hmm. And, that was, over time, what kind of put me into this position. It was first growing up playing soccer. Dad was coaching, got to experience the highs and lows of team sport, as well as all the injuries that come along with that as you start to push the envelope and play a little bit more, at a higher level or a little bit more frequently. You work your way through thinking, hey, I'm going to go all the way with this sports thing, and over time realizing that it's probably not everyone who ends up playing professional soccer or professional lacrosse or going the distance. Mm-hmm. And then you kind of bring it back and say, hey, education's probably important. I should go through that. Finished my high school time, went off to university with the idea of either science or kinesiology as a main focus, because at the time, I wasn't entirely certain what I wanted to do. At the end of high school, I'd done some of what's now known as the cadets program, but prior to that, for us, it was the student challenge with the VPD, Vancouver Police Department, and went through a lot of their training and thought, hey, this would be a really cool profession. And I really enjoyed the team atmosphere of it, went and did their program, and they said, go off and do school. You'll come back, you'll make more money, it will be fantastic to learn a little bit more about life. And so I went off to school. And while I was there playing lacrosse for the university at St. Francis Xavier, that and training a little bit of jiu-jitsu, had a back injury. And that was kind of the start of my whole journey into medicine, where I sought out the people I thought would be able to provide me a lot of help. Didn't listen to my parents at all, because as you know, in your early 20s, your parents know nothing.
Absolutely.
And then, except us, we knew a lot.
We know everything.
We know a lot, but we understand what you're saying.
But everyone else's parents, know nothing if they're yours. Yeah. And had an injury that dragged on and really couldn't get relief through a lot of the conventional methods. Ended up finally listening to my parents when I'd reached peak frustration. Was having to warm up every day to go to class, and that stopped being fun in your early 20s. Saw a naturopathic doctor. He gave me some injections in my back. And like 2 weeks later, I was 80-90% better. And I thought, damn, there's something to that. Yeah. I should have looked into this earlier. And once again, probably should have listened to my parents. And that was kind of the segue to it all.
Were those trigger point injections, or were they steroid?
It was actually called prolotherapy.
Oh, yeah.
So in the hierarchy of regenerative treatments, you can have trigger points, prolotherapy, PRP, and stem cells, not really available in Canada. But
right.
That's the hierarchy. And so I went into that at a very ground level with a doctor named Hal Brown out of Vancouver.
Oh, yeah.
And he was excellent. I went home and said, whoa, there's something to that. And, from that point, for the next several years, I had this really not misunderstood idea of what naturopathic doctors could do, but I shadowed a few more doctors related to that practice, and they were all chiropractors who became NDs who could inject.
Right.
And so my understanding of naturopathic medicine was, hey, these are docs who inject people all day. And I said, that's really interesting. It's a really niche part of sports medicine. It would be a really cool thing to check out. And then, kind of jumped in 2 feet first into the world of naturopathic medicine. I learned there's a whole lot more to it, both as far as what we could do, what I either choose to or choose not to do, as well as how you can serve patients in a middle ground in our medical community as a whole.
Totally. So is that your genre then?
Yeah, I would say 90 to 95% of my day are treating people who are, between the stages of seeing conservative care, so chiropractor, massage therapist, physiotherapist, personal training, and the ones who are either waiting for or haven't been able to gain access to physiatry or to sports medicine or to the surgical suite. Right. And so we try to find that middle ground and, bridge the care that's being delivered really well in our public system for people either who can't wait, have been given an unrealistic timeline, or who, are a little bit just at wit's end with what they've been offered so far.
I pick up a lot. One of the things I picked up is I feel like you have a sense of serving your community, because you talked about, there's opportunity potentially with the Vancouver Police, right, which is serving the community. What you're doing serves the community, taking care of people. You're a caretaker.
Yeah.
Yeah. Where do you think something like that comes from?
Where do I think being a caretaker comes from?
Yeah.
I mean, my mom was medicine adjacent. She worked at the Gait Lab and the Spinal Cord Center earlier on in her life. Both my parents were high-level athletes, and so, you know, I've seen the athletic community, I've seen the people who support athletes, and then I've seen my parents provide similar help to their communities. And from an early age, that was kind of the niche that I fell into. Around that same time that I was finishing high school, I also experimented doing some ski patrol up at Cypress Mountain and doing more of the paramedicine, and really found a love in being able to be outside, be with people, and, you know, give them the help when they needed it. So a lot of that was the catalyst for my existence in medicine. And, you know, I think any provider who goes into medicine can either relate or has a story where either they didn't feel like they had the care and therefore want to provide it for people, or who had a really awesome experience and want to, you know, emulate that for the next generation or for the people who are also searching for that. So a little bit of both for me.
We hear a lot when we're talking to people, and mainly around people who do sports, right? Whether it's an individual sport or team sport, they all require a same kind of higher level of commitment. Team sport is a whole other different thing, how to work with people and that. And how do you feel for you having that experience growing up with soccer? Just side note, was your dad a good soccer coach?
My dad was an awesome soccer coach, but you know, it's polarizing working with family, right? Like,
right.
I think my dad can probably express extreme frustration with me as a kid, where, you know, if dad tells you, hey, go run a lap, or hey, you got to do this, it's like, no, Dad, why the hell would I do that?
Right.
Yeah.
And then if, you know, Coach Dan says, Garrett, run a lap. All right, I'll run 3.
Yeah.
And so, you know, there's always that back and forth between kids and their parents. But yeah, it's an awesome soccer coach.
That's good.
Taught me a lot, helped me, you know, grow as a person, as an athlete, and, you know, opens up doors for you across the board.
Wow.
Do you have any brothers or sisters?
I am both the favorite and least favorite child of the family. So I'm also by default the only child in the family.
Gotcha.
Yeah, just me.
Just you?
Yeah.
Okay.
So circling back to the question then, and the reason I asked about if your dad was, I think I might have heard the story before, when my kid was 7, my son was 7 at Killarney, and they had no coaches, 100 kids won't play, so I stepped up knowing really nothing about, I'm not Sporty Spice, and so I ended up ruining 10 kids' lives for a season. Yeah, I'm not, they're all probably in their 30s now, but I apologize to them
I'm sure they turned out much better than you realize.
Okay.
You joke about, you know, ruining kids' lives. I think you probably did an awesome job. I think coaching, you know, there's coaches who, you know, may not be super familiar with the sport, but still give it 110% and develop a good culture around sport. And I think you probably did an awesome job. I think every athlete's had the highs and the lows of coaching, and, you know, learn different lessons from both. I know certainly I have, and it, you know, all really comes together as far as how you want to show up either as a person or, you know, in business as a coach to your patients, because at least in my sense of it all, you know, medicine, you do deliver medicine, but the best prescription is the one someone will follow, and to do that you need to understand someone and their motivations, because what's right for most people may not be right for you.
Yeah. So going through all the education that you had, man, that takes a lot of time commitment.
It does.
It takes a lot, even in those times when you don't want to.
Oh yeah.
Which is very much a sports mentality.
Yeah.
So how did your growing up in, well, sporty parents, for one thing, at a high level, as you said, how did that guide you through your education?
I mean, it certainly teaches you how to, like, for lack of a better word, grind or be consistent and disciplined with the work that you need to get done. I mean, to understand all of medicine, to really try to cement it, not just so you can regurgitate it on one test, but so that you can remember it on the day that you need it, right? You know, you don't go into practice every day saying, oh good, I reviewed that one specific red flag that I haven't seen in 10 years. You need to have that in the back of your mind. I think, you know, playing sports and, you know, having the mentality that I need to be ready for, you know, anything that can present itself to me. I need to be practicing consistently and constantly bettering myself, or I'll get outpaced by everyone else. Really does translate into medicine, because it's well understood that by the time you graduate, the information you learned on day one is outdated. And that, you know, every 4 or 5 years, whether it be a new treatment, whether it be a new direction, whether it be a new mentality around treatment, you need to be on your game and keeping up. And I think that growing up and playing sports really helps you develop that over time, as well as just the desire to do that, because you don't just get in, check the box, and say, cool, I made the team. You get in, you make the team, and now it's time to practice, and that's really just the first step. Then hopefully, you ride off onto the championship team and make that run. And in medicine, it's similar, different, but instead your championship game is every day with every person who's coming to you looking for help.
Yeah. Do you have a lot of patients who come to you frustrated with the traditional medicine route? And how do you handle that?
For sure. When people come to me and they say, hey, Garrett, I've got this knee arthritis, or I've got this injury in my back, and I've worked with some awesome doctors, but my timeline's 3 years before I get my knee replacement. And right now, I can't barely walk, I can't play sports, I can't take care of my family and my friends. And, whether that's from an athlete's perspective, losing that identity as an athlete and worrying about whether they're going to lose all their friends and ability to relate to people, or whether it's the father or the mother who's saying, I can't provide, I can't be there. There's certainly frustration, and, there's not really a provider to blame in that. It's more just that the system takes time. And sometimes that timeline's unrealistic for you, because of backlogs or because of something that's happened more acutely, and you just need help. There's certainly people who go see providers and are frustrated because they don't feel heard. And I'm fortunate enough to have the time to spend with people to really say, what's happening in your life? How can I help? And what are you looking to get out of it? Because as I alluded earlier, there's 1,000,001 ways to treat a patient. And the most supported way, the most understood way, maybe something you hate, maybe something you can't afford, maybe something that's not sustainable for you. And as a result, it's the worst possible direction we can go. And having that time to talk to someone and really understand their values and their morals and their goals, that's really where you can start to make a prescription that'll stick and that can make long-term change for someone.
So you and I know a lot of the same people. We network together, we know a lot of the same people. So within that group, and by a lot it's hundreds. And so it is.
It's at least 5.
Is it?
It is, just by nature of what we do. And many of those people work with you. And the one thing that when your name comes up, it is always like with a smile and glowing, or a recommendation, or everything amazing that you've done in your personality and everything. Like, you have this characteristic and bedside manner, if you will, about you that really engages the people. I know they feel heard and held, if you will, and everything. And they always say nice stuff about you.
I pay all of them, so
whatever works, in my opinion, whatever works. But it's really a really great quality, because I'm sure, like in any industry, not everybody has that.
And I think it's even more intimately important when you're doing what I do, which is primarily injection treatments for pain, because people have already done the rehab, already tried the first-line medications, are waiting for a surgical consult, and they're coming to me saying, if it's a knee injury, hey, can you poke my knee with a needle? Can you inject something? Can you do something to make me feel better? A lot of times, and understandably so, that's really not fun to consider getting poked with needles or have your back poked, like whatever it is. And so there has to be a lot of trust there. And so the number one thing is making sure someone's comfortable. And, the way to do that is to relate to them, to be empathic with them. And, for the person who's gung-ho, that's easy to jump into. And for the person who's really nervous or apprehensive or had a previous bad experience, which, is quite common, building that trust and being relatable goes a really long way.
So from your experience, you deal with pain, right? And what would you say separates patients who choose recovery, who choose to recover, from those who like to stay kind of stuck in a pain cycle?
A lot of it's mentality, right? Like the people who are stuck in a pain cycle, it's often because of either the messaging they've been given of, hey, you're broken and you need help being fixed, or it's the people who've given up on that and are waiting for someone else to find the solution to that. We think about it, at least in my world, when we're talking about corticosteroid injections versus something like PRP, masking a symptom and giving relief, which is super necessary a lot of times, versus creating a solution for it. A lot of times it comes down to time frame and desire, and the people who are come in saying, I'm broken, everyone's told me I'm broken, I just need to wait for someone to fix me. They're the people really motivated to have a quick fix, because they want to win, and they want someone to say, we can change your situation. And the people coming in saying, it's a setback, I'm ready to heal, they're the ones who are more likely to, show up and really be curious and really want to have the outcome that's going to work for them long term.
Right.
And they're the people who've either been athletes or athletically minded people, or who still have hope. They're recently injured and they still think there's a huge chance that'll happen. Whereas it's a lot harder to dig the people out of it who've, been the ICBC patient for 4 or 5 years, who've seen 20 providers, who come in saying, my knee's toast, I can't do anything, I've got no hope of getting out of this. Very different people.
Yes.
A patient comes to mind yesterday, back injury, really ruined their identity as a father, really ruined their identity as an athlete, and made them question a lot about their livelihood. And for them, a big part of the treatment, outside of doing anything physical, was just reminding this person that, hey, they'd acutely flared up. It was nothing like their first symptoms, but that catastrophization and that cycle of I'm broken, I can't do anything, was a big part of what was stopping their recovery. So you start to reflect, and they're a martial artist, and they're like, well, I can't deadlift. Okay. But I saw a video of you kicking some guy in the face 3 weeks ago before you hurt your back. Deadlifting, cool, can't do that. But you just kick that guy in the face. You're still very athletic. You're still very capable. You can still do everything you want.
Yeah.
But we need to shift that identity. We need to remind you you're strong, resilient, and can heal, and then provide you with the right therapies that help you at that time.
So part of what you do is, obviously there's a therapy, like a mental therapy and counseling aspect to it as well.
Yeah.
And that was something I didn't recognize myself growing up. And it was something I didn't recognize until I was in my 4th year of school doing my internship. And I was on a shift with a doctor who is good at sports medicine, but is also dual licensed as a counselor. And we'd be in a room with a patient, and, I might just be providing what to me was really routine physical medicine treatment, and he'd throw in a little comment about it sounds really hard, it sounds like you're going through a lot, and you just see a patient go, yeah, and you're like, okay, I'm here going, oh, there's some tension in this muscle, we got to treat this tendon, let's get this done, and they're sitting there going, I haven't been heard. And even just the comment of hey, I understand it. Someone's shoulders drop, they take that breath out, and you realize, hey, that person's been waiting to be heard this whole time. They're not just an MRI finding, they're not just an ultrasound finding, they're not someone with a tear, they're someone who's going through something, and getting them that relief, giving them hope, giving them a plan that will hopefully work, goes a long way for them once they've been heard.
Right.
But before that, it's kind of them versus the world, when no one's really said, I hear you, I see you, and I'm here for you.
For sure.
Yeah.
How has it been starting a small business? Well, I guess it's a medium business or a large, but how has it been building your business? Was it overwhelming, or?
Well, I always laugh because when I was finishing high school, my dad runs an IT business, family business. His dad ran it, he ran it. And I remember kind of vividly when I got my first job, where you get a paycheck for doing something hourly, and he said, hey, did you ever want to, come and run the family business? And I was probably 16 or 17, and I said, no, Dad, I never want to be a business owner. That's no fun. Why would I ever want to think about payroll or anything else? And halfway through my naturopathic medical program, I went and sat down and went, oh, fuck.
Right.
I'm going to have to be a small business owner. What did I do? So part of that was daunting early on, when, you have to think, well, I don't just receive a paycheck. If no one shows up to my clinic today, I make no money. I can't help anyone.
Right.
Oh God, the uncertainty of it all. And I was fortunate enough in my first 2 years, whether you want to call it a residency or was just given a salaried position at Evoke, where I was able to treat patients in a genuine way, and what I did wasn't tied to my compensation. And so that conflict of interest, where you're sitting there on day one going, cool, student loans, hoping to do stuff with my life.
Right.
Where's the money?
Yeah.
Was kind of removed from the situation. I've seen a lot of people go through where day one, if you have a $50 treatment that'll work, or a $1,000 treatment that's going to work, if you don't have the morals to bring it back and say, okay, this is what's best for my patient because I've got a bunch of loans, you're going to make the choice that's better for you in a lot of cases, unless you're reticent of that bias. So I was very fortunate to spend the first 2 years of my career without that as a worry,
right,
where I could just genuinely help people. And I think that's grown a lot of the trust and respect that I have from my patients. so that now when I have to recommend the more expensive treatments, there's a good reason for it. I truly believe in it, and the patient knows that I have their best interest in mind, not my own.
Right.
And so I think that's gone a long way as far as a learning piece in medicine, especially being in the privatized sector where people come to you for advice, and if you say, we got to jump this high, they'll say, yeah, sure. And so you have to make sure that's what's best for them. So that was probably like trial and tribulation number one as far as biases. And from there, the growth came for sure. And once I switched out of that employee role, things went a little bit more exponential, which was nice. And a lot of that was from the people I knew, the connections I made, so that I could improve not just the offering inside the session, but also how I deliver that to my patients.
Absolutely.
One of the things that we hear a lot of, and this is long before we started the podcast thing, from a lot of industries, health and wellness being one of them, is that, and we've heard it from acupuncturists and chiropractors and people like yourself, is that in school, one of the things they would have appreciated is a course on how to run a business.
Yeah. We did get some business courses, and I'm lucky that the person who taught us all of that is actually the clinic owner at the space I work. So we had already done business planning. We had already done visions of how all that was going to look and how we wanted things to operate from day one. And so that was part of why he chose me to work at his clinic, because him and I had made this little mastermind behind the scenes the whole way through. But yeah, I mean, there's still stuff today where, you get a curveball thrown at you and you go, oh crap, I wish I, not only had my naturopathic doctorate degree, but I wish I had a business degree and a law degree and an accounting degree, because, I can't figure it all out myself.
Right.
And again, as a small business owner, that's where, once you get to that point where you have to think about all of that with a little bit more time consuming.
Yeah.
When it becomes a more time-consuming part of the process, that's when your network becomes, your net worth, as you need to then farm that out to people you trust and let them run with it, so you can focus on doing what you do well, which in my case is the medicine and not accounting or insurance or law or anything else like that.
I mean, the mindset on it is great, because you realize you don't have to do everything or know how to do everything.
No, and I can't.
Yeah, you can't.
Yeah.
It's the same way with medicine, right? There's, 2 or 3 things that I'm really good at, and there's a lot that I refer out. Like when someone comes to me and says, hey, Dr. Garrett, I'm looking to get pregnant with my partner. I'm like, that's fantastic, congrats. Laura's office is down the hall. Go see her, please.
Yeah.
Because I'm going to do you a disservice. But when someone comes to me and says, hey, my knee's mangled, my back's mangled, I've got a lot of trouble with my hip, absolutely, I can help you. And from there, it opens up other parts of their health, which often ends up talking about heart health and longevity and their blood sugars. But there's a key way in, and that's what they find me for, as my niche. And from there, we can expand the conversation, but I'm certainly reticent to the things that other people do far better than I.
Yeah.
Right. Absolutely.
So pain. You and Jill are in the same world. You both work in the medical profession. You work with patients. You do all this thing, and with orthotrauma and hip and knee and everything. And like you understand each other. I do not. So I understand tib fib fracture and acetabulum. Don't know where it is or what it is. That's where it is.
Legs broke.
So I'm going to ask a question from my world and my thoughts. Pain, right? Yeah. Do you think pain, is it more of a physical problem, or is it something more of a nervous system problem?
There's both, for sure.
Yeah.
Like when we talk about pain, we spoke a little bit about the mental health side of it and how that can impact you, right? Like the moment you have an injury, that starts to impact your identity, that starts to impact your idea that you're invincible, as well as your idea of feeling capable, whether that be work, sport, or family life. From there, you get the physical, where arm don't move, things torn, things inflamed, I can't get to what I need to. That's physical. And then there's what was the last question you asked? Like there's physical, there's mental, and then the nervous system.
Yeah.
Mental and the nervous system cross over dramatically, and you'll see patients where, hey, I feel really good, and then I get stressed out, and all my pain comes back.
Mm-hmm. Right.
Well, it's not that they've gotten stressed out or that their workload at work's gotten worse, and so their knee's gotten 10 times worse. It's that their body is so heightened for fight or flight, and they're ready to go fight a saber-toothed tiger, and sitting in front of them is a board meeting package. Well, board meeting package isn't going to get up and claw them, but it feels like it.
Yeah.
And so part of dealing with pain is the physical, biochemical. We need to fix that rotator cuff tear. We need to, improve that arthritic environment. Second part of that is getting their bodies to de-stress. And part of that is reteaching the mentality of, you may have an injury, you may have some limitations, but look at all the things you can do. Look at all the ways you can support yourself. Look at the sports you can play, and let's focus on what you can do and how we can get you back to that, as opposed to, I can't, I'm a failure.
Yeah.
Because none of that's going to be productive long-term for them.
Yeah.
Would you be surprised if you knew that a lot of surgeons see naturopathic medicine as being an integral part of healing as well? Or do you see it as they never give us a thought, they're just out? And
I think across medicine in general, whether it be true or not, but the statement's been thrown out by multiple different people in multiple different industries, it's that medicine evolves one funeral at a time. I think there was a point in history where a lot of naturopathic doctors weren't providing good medicine or weren't providing standard of care. And there's a lot of times where there was zero collaboration from the conventional medical community. And so at that point, very much us versus them, because everyone was fighting for turf or fighting for space and providing treatments that were at least communicated as oppositional. And I think now with the younger generation of doctors, we're recognizing, hey man, surgery's awesome. Medication's awesome. I prescribe it all the time.
Right.
It's not always right.
Right.
Corticosteroid injections are awesome. The person with frozen shoulder comes in, they need it. The person who comes in with early stage arthritis, who's 20, 30, probably not the best treatment for them for the next 60 years. And once we realize that, I don't always have the best option, or I don't always have the thing they need, it becomes a lot more of how can I integrate and when's the most appropriate time to use each provider. The person who sprains their knee yesterday doesn't need to see me yet. The person who's tried nothing other than icing their knee doesn't need to see the surgeon yet, especially when they're 20 and, you can't go back from that surgery if something goes wrong. And so there's always, a time and a place for each treatment. And I think that the more that we learn to communicate and the more that we understand what each person's superpower is and where those lines should be drawn, the better we are able to integrate. And you find that for sure with the younger population of doctors. And it's often the older ones who haven't had a good experience with a provider who are harder to communicate with. But once you break that barrier down and you show competence, you often just filter back and forth with a lot more ease. And I've found that so far in my career as well. Once you have a patient who has a good response to your care and you send a note to the surgeon saying, hey, here's what we did, let me know what your thoughts are, happy to play a same role, then you start to build that community. And it takes time, but one person at a time.
I don't think we've ever gotten a note from a naturopath.
I send them all the time because I see...
That's great.
I see patients who are either pre-op or post-op, and I want their doctor to know what we've done.
Absolutely.
Because if they're going to go and operate on a knee or a shoulder, and I've done a cortisone injection within 3 months on a rotator cuff, they don't want to be operating.
You can't.
And if their patient's not truthful that they came in and sought care, that surgeon's going to have a weird outcome and wonder what the hell's going on. And if that surgeon is going to do a procedure and have a timeline in mind, I want to be able to follow that, right? I don't want to go mess with their work if they've set out a treatment plan already.
That's amazing, and it's probably maybe something that you should speak more of with. I don't know if there's meetings or. There must be.
Circle the crystals. No, I'm kidding.
Well, it's actually a really great topic to broach because I've been doing this a very long time and I have never had one note from a naturopath. But chiropractors we do. Yeah. Not from a naturopath ever. So that would be, obviously we haven't crossed paths, which is unusual, but not yet. But that would be great to have more open communication like that.
Totally. And there's a few private surgeons that I work with and do PRP for, and we have to have that communication because if they're laying out a treatment plan and the patient's either not following it, everyone's wondering why they're not getting better. And if they're telling them, I want surgery and I want PRP 6 weeks later, if I'm doing that, early, now I'm messing with a surgical site that is not yet ready to be messed with. And if I'm choosing to drain a post-op knee and the surgeon doesn't think that's cool, well, again, now I'm kind of stepping on their toes in a way that's, could be best for the patient, but could also create a complication for someone that is unnecessary.
Definitely.
We got to know what each of us are doing so that we can make the right choices for people.
I agree.
Yeah. I have an age-related question. When you're a young buck, when you're young, the world's your oyster, you can do anything.
Yeah.
And I asked this question, and I think we shared this in another podcast. I'm 59, so when I was 47, I was at this retreat thing, and I was doing this. There was under 40s and over 40s, and the under 40s were doing these Cirque du Soleil moves one day where they were counterbalancing on each other, and me and this guy from Alberta sitting down watching this, and went, oh, we got this. And so I stood up, and he put his foot on his knee, and the whole idea was he was going to put one foot behind my neck, and we would counterbalance. Like,
do you have a video of this?
Huh? No. And so on the count of 1, 2, 3, he put every single pound of his body into my knee and blew it up. Like it exploded. You can hear it explode, and I went down. And I ended up, almost detaching my ACL and torn meniscus and all that, right?
Who needs enemies when you got friends, right?
Right. And then Jill, working in that field, I took a few days before I told her, and then when I came home, she didn't talk to me for a day. She didn't. And then she gave me let me see what you did to your fucking knee the day after, and then I got to see her surgeons. When I saw the surgeons, and I was telling them the story, because I thought it was funny, there was a surgeon and a resident.
Hilarious.
They both had their arms crossed, and they stared at me, and the surgeon said, you're 47, right? And I said, yeah, but I'm not dead.
I feel 25.
Right, exactly, which is the long-winded way of me asking this question about, because also I know Jill experiences a lot of times, like high-level athletes in their 80s who are still whipping down Whistler Mountain on their bikes.
Totally.
And then they're surprised when they break something, but they got to get peeled right away because they got to get back up there. And so you probably see that as well.
Absolutely.
Yeah, and so advice time. Dr. Garrett's advice. Do you have the weekend warriors or the
old people skateboarding?
Yeah. Because it's not stop.
It's not stop necessarily if that's your passion.
No, it should never be stopped, right? Like in business, we always ask the question of like, hey, you want to retire? Well, retire to what? And the same thing with athletics, right? If you just decide, I'm 55, that's it. I don't need to exercise anymore. I can't. Well, a lot of bad things are going to happen, right? You're going to detrain immediately.
Yep.
You're going to go from being the guy who can hike the grouse grind to being the guy who needs a walker to get off the couch pretty damn fast, right? Because what do you replace that with? Well, you need something. And for a lot of people, that's overindulgence on food or alcohol or stress and sedentary behaviors. And we all know that makes your health go like this.
Right.
And we see the contrast to that, the people who were active as a kid, stayed active, and then made a good push to be as active as they could into their 60s, 70s, 80s. They're the ones who are running past the nursing home instead of sitting in it.
Right. Totally.
And, that is a spectrum. They always say, there's no better day to start than today, and that's for good reason, right? If you wait till you're 70 or 80, you can do it. There's 70 and 80-year-olds who get strong and get able, but the person who started at 60 has a lot longer to develop that strength, a lot more capability to develop that strength, and doesn't start as far in the hole. They haven't lost the muscle mass, they haven't lost the bone density, they don't already have diabetes. And so they're able to get there and maintain it a heck of a lot easier than the person starting later in life.
Yeah.
Great advice.
Yeah. Jill's always promoting that too.
Yeah.
Get off your ass. Go do something.
Yeah. Don't stop. Carry on.
Yeah.
It doesn't have to be the triathlon. It doesn't have to be the 1,000-pound deadlift.
Right.
It's what's important to you, right? If you need to be able to do your laundry, it's, that involves a squat. What do we need to get you down into that position? Balance, strength, and some coordination. Can you do that based on your injuries or your health that you have currently? Hopefully.
Right.
If not, start out by learning that as an exercise and building up your capability. You probably can't do it 100 times on day one, but you can probably do it once or half.
Yeah.
And from there, you can build on that strength. And if there's a barrier, some arthritis, instability,
Right.
let's work to fix that. And let's do that sooner than later, because it's always easier to fix in the mild to moderate stages than completely wrecked stages.
Yeah, deconditioning is...
Yeah,
it's tough.
I think it's great advice, because I know a lot of times as we get older, and sometimes it happens to people, happens a lot, they start to mourn certain parts of their life. Yeah. No, I can't do that. So it is a stop. And then you end up on a couch.
Right.
Totally.
And nothing.
A lot of times those are the people who say, I really don't know what happened. I hit 50 and suddenly I can't do anything. And suddenly, I've gained a lot of weight and suddenly, I can't ski anymore and my kids are outpacing me.
I feel like he's eavesdropping on my mind.
Why?
Those are my internal thoughts. He's talking about, I hit 50 and all these things went downhill.
Yeah, but you go to the gym almost every day.
I do now, yeah.
So now you're putting in the work, right?
Yeah, definitely putting in the work, yeah.
And it's for those people, it's often not that, Rome was built or destroyed in a day. It's that they, got into a habit and one day they looked up and they saw their buddy who they used to keep up with, who never stopped, out with his kids, out with his dog, up on the mountain, doing what they do. And he's stuck saying, well, the car doesn't go that far.
Right.
Yeah.
And that's a confronting moment for people. And again, brings back identity, brings back the mental health of it all.
Right.
Because everyone, whether it's post-injury, whether it's post-realization, goes, well, why can't I run the 100 miles? I used to be able to do that.
Yeah.
Because you haven't run 100 miles in a long time.
Yeah.
And that's okay. But we got to start with one, and we can build you up to it again.
Absolutely.
Yeah.
And I think there was a point where, there were too many happy hours, too many dinners, too much alcohol, too much,
If there was having to give up something.
Yeah.
I shouldn't say giving up, but it's moderate.
Yeah, we had to moderate and look at it, and more gym time, more fresh air, and less alcohol, and less this, less that. Yeah.
Yeah, it's going with the flow and change. People don't like change, so not changing your life, but shifting it so it works better for you, so you can extend your life.
Yeah, we still go out and have fun and everything. We just don't want to do everything to excess all the time.
I mean, it's
Right?
hard to go 0 to 100 on anything. It's probably not good for you to go 0 to 100 on anything, because you'll just break something or hurt yourself or burn out of it. One of my supervisors, albeit not a medical term, used to say you got to healthify first, right? You got to take all of the things you're doing and just gently shift them. And you make a small shift that changes your perspective on it. You're suddenly identifying as a healthy person. Healthy people do all this stuff, and over time you shift further and further towards that goal until you look up one day and go, oh my God, I feel so much better than I did when I was 30 or 40, because look at all the stuff I'm doing again. Because we all probably go through that stage of, we go through school, everyone tells us what to do, we finally get our freedom in our mid-20s or 30s, we say, hell yeah, I can do all the things I've been wanting to do.
Yeah.
We run with it way too far, and we either shift out of that pretty quick after university, after we've had our fun, or we end up looking back 40, 50, 60 and going, oh crap, what happened? And that's really the confronting moment for people. So if you haven't started, start somewhere and build from there. And if it's not today, it's tomorrow. And if you fail tomorrow, try again the next day.
What's been your biggest patient success story?
My biggest patient success story, I have a few fun ones, but the one that sticks out to me as far as how I apply things is to our point, I think he's in his mid-60s, skier, traumatic knee injury, fell down, tore a bunch of stuff, had cartilage damage, a bunch of arthritis, a bunch of swelling, and one of our family friends referred him to me, and he came in saying, Doc, my knee's done. I've seen the orthopod, they say I need surgery desperately, but I gotta ski this season, and what can I do? And I scanned it, said, hey, your knee's really swollen, we should do something. Here are the options I'd lay out for you, either gel-based injection or PRP, or if we really need to, just a steroid to get you through. And he said, I really hate the idea of steroid. I said, okay, but all good. Let's talk about it. He said, I need to be able to ski. I said, all right, so let's probably do something like a gel injection, give you some cushion, let you try to get back out there if you can. But mainly we just need to get the pain down. And he disappeared for about 2 or 3 months, and he came back in, and I said, hey man, where you been? He said, I went to see the orthopedic surgeon, they did a blind knee injection, it didn't get any better, can we do that other thing you wanted to do? And scanned it with the ultrasound, and I said, well, yeah, they did a blind injection, it was with the right product, but it's sitting in the wrong place. We can see it up here in your quad tendon. It's not going to do anything well for you. So with the ultrasound, I said, hey, do you trust me? Can I give this one other shot? And if it doesn't work, don't pay me for it. I don't care. Just give me a chance to try the treatment someone else did, because I think it's right. We just need to apply it differently. Drained his knee, put the gel in, didn't see him for 8 months. And here I am thinking, didn't work. He disappeared. He probably got the surgery. And I got a text, I think it was middle of February, 6 or 8 months later, and he goes, hey doc, I just finished a big ski race in Whistler, felt no pain in my knee, day one I was told I'm not going to ski again, and now we're back doing what I like, and spent the whole season skiing with my kid, did this race, never would have been able to do it without you. So, cool.
Amazing.
Not doing anything different than other people, taking the time, do all my injections under ultrasound for accuracy, and was just able to deliver care in a different way that in his case made a big difference, and took him from being incredibly stressed about not being able to show up for his kid at ski season, not being able to compete and be the athlete he wants to be, back to skiing and competing. And I think for his age group, he came second of all the people racing in Whistler. So from
nice, good.
I'm not going to be able to run again or ski again to ripping it up and coming home with a medal was a pretty good one.
That's a good one, yeah, for sure.
I nod my head like I understand what you're talking about. My question, PRP, what is it? How does it help people?
So when we're talking about treatment options, we kind of got the anti-inflammatories, which play an important role in for people who are late stage in an injury, or for people who are in so much pain they can't do anything. Super good treatment, but it's kind of just like taking the batteries out of the smoke detector. So for a young person or a person not ready to go down that surgical route in the long run, it's kind of just prolonging the inevitable, or signing that deal with the devil where it feels awesome but isn't getting fixed. Hyaluronic acid or gel, it's kind of like an oil change. So for a bum knee, you put a little bit of gel in there, cushions things for them. And then prolotherapy, PRP, and stem cells, they're not necessarily fixing a structural problem. So if a knee's completely torn, or if there's so much arthritis it looks like the Rocky Mountains, you're not smoothing that out. And the concept of regenerative treatment, I think, is a little overstated, but it's changing the environment in that joint. And what you do with PRP is you basically do a blood draw, you take the healing factors that are in a person's blood, which we'll just consider for argument's sake is 1 times or 1 unit of that, concentrate it down so that instead of all this volume, you take the cells from that small volume, shoot it back into the knee or into the tendon or the joint, whatever that looks like. That changes the environment in the knee, often reduces pain, and if a tendon's all swollen, can help that tendon heal up.
Right.
So it's not a quick fix, takes some patience, takes a bit of discomfort, much like a small surgery might. But instead of just taking away discomfort, it can positively shift that environment, and it's repeatable. So when the 20-year-old comes in and says, hey, I tweaked my knee, or hey, that tendon's aggravated, you can tell them, we can probably delay you having a long-term issue with this, create a fix for it, and repeat it until you're 80 if need be, without wearing it out faster than we might with something like a steroid. So it's our chance at fixing things if we can.
I'm doing really well with all the needle talk.
Yeah, you are.
Have to give me that.
Hasn't even fainted yet.
I have a massive needle phobia.
Massive. It's really not
and
good.
I've held out well. Thank you.
You have.
It's because of you. See, that's what I said. You're very
therapy.
calming. If you can calm me down, you can calm anyone down.
Can we play a fun game?
Absolutely.
Okay. Rapid fire.
Rapid fire.
Okay. First one. One word your friends would use to describe you.
Geez. I want to say like calming is a big part of it. I once had someone refer to me as, what was it? What medication was it? It was, we might have to pause and I'll come to it. You can ask that question again and I'll say it better. But they referred to me as like a benzo, one of the anti-anxiety meds.
Lorazepam
it was something like that, exactly.
Ativan.
Yeah, it was Ativan, that's what it was. They said, you're like my Ativan.
Yeah.
I was like, I don't really think about that.
That's a good thing.
Yeah, that is good. Hidden talent most people don't know about.
Hidden talent. My hidden talent when I was, actually I'll go with karaoke.
Oh,
You sing?
Not
No
well.
way.
Not well.
No, but
At my partner's family reunion recently, me and one other person were the only 2 people who went up for the whole night and just sung for like 3 or 4 hours into the whole genre through
that's
rock
cool.
and roll and rap and everything.
is that a liquid courage thing, or are you just like, hey,
Just
I got
not
this.
afraid to embarrass myself.
Nice.
cool. Love that.
Put it out there.
I always was, and went to university, and I saw their orientation committee, the people who were there to make everyone comfortable, and they really hammered home that idea of like, well, why do you care who's watching? Like, why do you care what people are going to think of it?
Exactly.
And so I joined that group the next year, and it was basically, let's wear the brightest, most like in-your-face outfit you can, and let's embarrass ourselves so much that the person showing up on their first day of school, or the person showing up for the experience that's scary for them, is like, oh, I'm so incredibly normal, this is crazy. Because that guy is out of his mind. And so it's kind of stuck with me as far as, you can show up and make someone else comfortable just by being yourself.
Taking care of the community.
I know, right? First job you ever had?
First job was as a volunteer at a bike camp.
Oh, okay.
Yeah, so I
pedal heads or something?
Yeah, it was actually pedal heads, yeah. I was a volunteer there, and within that first summer, got a job with them and worked my way up into managing a couple of their camps for a few years as I went through that whole process.
One detail you always pay attention to?
People's energy and how I'm making them feel. Because again, when we're talking about medicine, someone comes in super anxious, you can't jump into needle talk if you can sense that someone's really anxious. You got to break down some barriers first.
Yeah.
So a couple last questions.
Yeah, shoot.
I'm one of them young bucks, and I'm like, you know what?
You are a young buck.
Yeah. Thank you. He also doesn't tell the truth. Whatever. No. I want to become a naturopath, right?
Yeah.
What advice would you give to the up-and-coming people who are in just exploring the field at the moment?
Pick the right school that's going to support what you're looking to get good at. There are certain naturopathic medical schools that are really focused on, becoming a really good generalist. There's some that allow a lot more specificity to your training. And so for someone who wants to go into the sports medicine field, school down in Arizona, for example, they do a really cool program where before you leave, you're getting good at ultrasound guided injections, you're getting good at x-ray guided injections. That's something just not every program provides. But outside of picking the right school, it's really just be open to what you can learn and then get incredibly focused on what you want to be good at. Because unless you're going to go off to middle of nowhere and do medicine in a rural community where everyone needs somebody and you put up your sign on day one and you've got a 200 person line, they're not going to come to you unless you're good. No one Googles, I want a doctor who's really average at lots of things. They Google, who's going to be the person to help me with my knee? And then your name pops up because that's what people talk about. Yeah. And so, if you can become really good at one thing and set yourself apart, especially in the private medicine sector, that's really what gets people in the door.
That's great advice.
And the last question for you is, what is your number one key to success?
In business or with patients or both?
Yes.
I think with business, it was understanding who I wanted to see and what I wanted to do. Again, it's spending all of that time before you jump into it, understanding your ideal client, understanding who you want to talk to, what your messaging is going to be, so that you can find those people. Because again, if you open up the doors and see everyone, one, you're not good at it. Two, it's going to feel draining when you get that patient you really don't know anything about and don't want to see. But it's going to be incredibly motivating when you get the person who comes in who you can help and who you're there for. And unless you understand who that person is before starting, you're going to wander around in the forest trying to figure it out without any direction. From a medical perspective, I think it's listening to a patient. Because again, you can lay out an array of options for someone. And I say it all the time. I say, we're a team in this. I'm not just going to throw stuff at you. I'll give you, what I think is going to be the best option. And frankly, tell me if you fucking hate it. Because if I tell you something that I think is going to work and you either can't afford it, don't want to, or hate the idea, it's the worst prescription in the world.
True.
And if I can distill it down to something that either you're able to do with your busy life, that you can't afford, or that you feel excited to do every day, that's the best prescription in the world, even if it may not be the perfect prescription.
Right.
Yeah, awesome.
Excellent.
All right, Dr. Garrett. How would people get a hold of you if they want to connect with you or contact you?
They can go on Instagram and follow me. I think it's Dr.Garrett Bramall. That's a super easy way. We've got our website, evokelife.co. And then if anyone wants to get in touch with me, they're welcome to reach out either on Instagram or our email through the clinic and ask any questions they've got. I always leave time in my schedule for what we call free health strategy sessions, which is basically 15 minutes to pick my brain about anything you want. Whether you become a patient or not, the goal is always education, because if you don't know what options you have, you can't go seeking them. Right. And if you're early in the process, well, at least I can guide you. And if I can help, then I will. And if not, I'll make a good connection for you so that someone will.
Awesome.
Wonderful.
So we're going to have all your contact information in the descriptions, either on YouTube or through the podcast. We'll put all your links and everything on there. We want to thank you for being on the big show.
Thank you.
We do. We have for you the coveted gift bag, swag bag that contains our mug and our sticker, and here it is, your own very own Fuck the Details cap.
I gotta put the Fuck the Details
He's
cap
so
on.
excited.
Yeah, here, 100%.
You can do that right now.
We can do that
on
now.
There it is.
Boom.
Oh,
We'll
man.
tight. We'll make it fit.
Yes.
It looks awesome on you.
It does look really good on
Gonna
you.
wear it every day.
Love it.
love it.
Thank you guys for having me on the podcast. It's a lot of fun.
And well, we appreciate, we talk about fuck the details, and there's times when you got to say yes to the details, and I know you're very detail oriented with your patients.
Yes.
So that's the whole point of this show. We do want to thank you.
Yes,
for
we
taking the
really
time to be with
appreciate
us
it.
today.
Thank you so much.
And for all of you listening again, if you want to connect with Dr. Garrett, please check out all his connection details within the descriptions. And don't forget, because we're not afraid to beg,
Subscribe to
our YouTube channel. Follow us on everywhere you can, or just go to effingdetails.com. That's where we're at, and you can find everything there. Once again, thank you for being here.
Thank you.
Thanks for having me, you guys.